Welcome to the Mad.Forensic.Scientist channel. Hope you hit that subscribe button and enjoy this webinar.
And welcome to today's webinar on the background of infectious disease testing. First, we'll start off with urinary tract infection, or UTI testing. Did you know that urinary tract infections are responsible for nearly 10 million doctor visits each year? 1 in 5 women will have at least one UTI in their lifetime. Nearly 20% of women who have a UTI will have another. Of those, 30% will have yet another, and of that last group, 80% will have reoccurrences. UTIs can be treated effectively with antibiotics. However, antibiotic-resistant strains do exist. People who get repeated UTIs may need additional tests to check for other health problems. UTIs may also be called cystitis or a bladder infection. A breakdown of the urinary tract infection includes the kidneys, the kidney pelvis, the ureter, as well as the bladder and urethra. A urinary tract infection is what happens when bacteria get into the urinary tract, specifically the bladder, and multiply. The result is redness, swelling, and pain in the urinary tract. Most UTIs stay in the bladder before they pass out through the body. If a UTI is not treated properly, the bacteria can travel up to the kidneys and cause a more serious type of infection. Pyelonephritis is an actual infection of the kidney and may result in fever and back pain. Common symptoms of UTI include dysuria or painful urination, straining to void, nonspecific urethritis, painful micturition or discomfort or burning during urination, or frequency of urination, urgency of urination, as well as inflammation of the epididymis, as well as testicles. Also acute prostatitis, interstitial cystitis or acute cystitis, abscess epididymis or of the testes, inflammatory disease of the cervix UTI, female pelvic peritonitis, unspecified symptoms, or hemoglobinuria or hemoglobin in the urine, as well as elevated ketones in the urine, elevated proteins in the urine, glucose or other sugars detected in the urine, lymphatic fluid leaks into the kidneys, making the urine milky white, or when the urine turns dark red due to excess of myoglobin. Ways to detect UTI. Since the 1950s, urine culture has been the gold standard for diagnosing UTIs. Although molecular diagnostic approaches use DNA amplification techniques have replaced these outdated techniques, UTIs are often still diagnosed using urine culture. The standard culture presents significant limitations for detection of the full spectrum of the urine bacteria species due to the slow-growing bacteria that die in the presence of oxygen. So faster, more accurate diagnoses are available today, and then there is still a missing component: the effective antimicrobial susceptibility testing, or AST. Most non-PCR based testing focus heavily on defining optimal uropathogen colony counts to diagnose UTIs. However, very minimal efforts are devoted to identifying specific antibiotic treatment to eradicate the infection. Urine culture versus PCR. 67% of pathogens are missed in the standard urine culture, and 50% in patients with severe urinary symptoms. UTIs are some of the most common bacterial infections, affecting over 150 million people each year. Studies have shown that depending on the population, up to 80% of urine cultures are negative, underlying the need for more effective methods of diagnosis. Here are some lists of common pathogens found in UTI, including fungus, bacteria and protozoum, as well as antibiotic resistance strains. Next, we'll talk about sexually transmitted infections, or STIs. Important focus of STI testing is the early detection. Many STIs can be asymptomatic, meaning the individual may carry or spread the infection without being aware. Regular testing helps identify these silent infections. Early detection and treatment significantly reduce transmission rates and play a pivotal role in controlling and ending STIs. Testing assists in evaluating the efficacy of treatment protocols, ensuring patients are effectively treated, as well as a holistic health evaluation. STIs can often be comorbid with other conditions and can increase the risk of other complications. Testing can guide and allow for a more comprehensive health evaluation. Some common STI facts. Do you know that new STI strains emerge periodically? This makes periodic testing and updated diagnostic methods paramount. Every day, more than 1 million STIs are acquired worldwide. And of these, 70% in women and 50% in men with chlamydia do not exhibit symptoms, underlying the importance of routine testing. And a person can be reinfected with an STI even after successful treatment if exposed again. Regular testing post-treatment can prevent complications. Some common STI and symptoms are chlamydia, which in males distributes as urinary discharge, burning sensation during urination, and testicular pain. It manifests in females as abnormal vaginal discharge, burning sensations during urination, and abdominal pain. And gonorrhea, which manifests in males as yellowish urethral discharge, burning during urination, or painful and swollen testicles. And in females, vaginal discharge, pain during intercourse, and fever. Herpes, herpes simplex virus 1 and 2, in males and females are often seen as painful blisters of genitalia, mouth, itching, and flu-like symptoms. Trichomoniasis manifests in males as itching or irritation inside the penis, burning sensation after urination or ejaculation, and in females it manifests as itching, burning, or soreness in the genital area, as well as discomfort during intercourse. Gardnerella bacteria manifests as asymptomatic in males typically, however, can be manifested as urethritis. And in females, the major contributor of bacterial vaginosis, women might experience a thin white discharge, fishy vaginal odor, vaginal itching, or burning during urination. Another bacteria is Mycoplasma homini, and in males it could be asymptomatic or it could cause non-gynecological urethritis. And in females, it's a natural part of the flora. However, overgrowth can lead to bacterial vaginosis, PID, or complications during pregnancy. Some common STI pathogens include these fungus, viruses, bacterial and protozoan, as well as antibiotic-resistant genes. Now we'll move on to wound care testing. Decoding wounds, the PCR pathogen detection guide. The rising incidence of antibiotic-resistant bacteria have emphasized the importance of judicious use of antibiotics. Misuse and overuse of antibiotics not only lead to reduced efficacy, but also contribute to the global health threat of antibiotic resistance. Wounds, though often seen merely as physical injuries, are a complex battleground of microorganisms. Wound care pathogen PCR testing illuminates the unseen, bringing pathogens to light and paving a way for precise treatment. The PCR approach. Precise diagnostics are important, leveraging state-of-the-art laboratory techniques to identify these pathogens as well as their antibiotic-resistant profiles, to ensure that the appropriate medications are used and chosen precisely. Testing often provides recommendations for testing or for treatment based off of antibiotic recommendations that can encompass the most effective antibiotics for identified pathogen, the potential dose and route of administration, duration of treatment based on the infection type and severity, as well as possible alternative antibiotics in case of allergies or other contradictions. Utilizing the wound report. The microbial melting pot. A single wound can host multiple types of bacteria, fungi, viruses, and some of which may be working together in a biofilm, making treatment more challenging. This makes rapid PCR testing one of the fastest ways to identify pathogens, often delivering results in just a few hours compared to days of traditional methods. Precision matters. Early and accurate identification of wound pathogens can significantly reduce healing time and prevent complications. With the identity of the exact pathogen causing the wound infection, you can select the most effective antibiotic treatment, reducing the trial and error approaches, as well as monitoring the progress and using the reports, subsequent reports to track the efficacy of treatment, adjusting as necessary. Reasons to order a wound report: a staph infection, open wounds with layers exposed, typically the fat layer, type 2 diabetes with skin ulcers, atherosclerotic native arteries with ulceration, chronic venous hypertension with ulceration, acute osteomyelitis, unspecified open wounds, skin grafts, disruption of the external operation or wound dehiscence, and other complications of skin grafts. Common wound pathogens include fungus, bacterium protozoan, as well as antibiotic-resistant genes. Respiratory pathogen panel, or RPP. RPP checks for pathogens in the respiratory tract. That includes viruses, bacteria, or other organisms that cause an illness. There are many types of viruses and bacteria that can infect the respiratory tract, and symptoms are often similar, but treatment can be very different. That's why it's important to make the right diagnosis. Other viral and bacterial tests for respiratory infections are often limited to testing for one specific pathogen. So several samples may be needed, and the process can be difficult or time-consuming. Common RPP symptoms. The following symptoms may be due to an air droplet or airborne infection: coughing, sneezing, stuffy or runny nose, sore throat, headache, weakness, fatigue, muscle aches, fever or chills, wheezing, difficulty breathing, or a low appetite, and in some cases, diarrhea and vomiting. An RPP is used to help diagnose viral infections such as flu and the common cold, respiratory syncytial virus or RSV. It's commonly and usually mild in the respiratory infection. However, it can be dangerous to babies and the elderly. Adenovirus. These can cause different types of infections and may include pneumonia and croup, an infection that causes hoarse, barking coughs, as well as bacterial infections such as whooping cough or bacterial pneumonia, as well as antibiotic genes. Common RPP pathogens include viruses, or with influenza, coronavirus, COVID, SARS, parainfluenza, bacterium, which often cause pneumonia or pertussis, as well as resistance genes. There are antibiotic-resistant strains of these bacterium. And with that, I would like to thank you for watching our presentation today.
Hope you enjoyed this webinar. You can find the link for Toxicology Tuesday's playlist right here, as well as you can find the Twitch for the live streams in the comments below.